Good evening, ladies and gentlemen. This evening, we want to review the care plan, the inside page, part 2, where we have the nursing diagnosis, objective stroke outcome criteria, nursing orders, nursing intervention, and then evaluation. All right, so for our patient, Achipalago Moses, I hope you remember the front page of this care plan. We started somewhere. So if you have not, you want to understand this care plan very well, you need to watch the part 1, the front page of it. So we diagnose Achipalago as a hyperthermia 38.5 degrees Celsius related to inflammatory process of the condition. His condition was typhoid fever. And then our objective and outcome criteria was set. And our objective reads, we say patient will regain his normal body temperature within 30 minutes as evidenced by patient verbalizing absence of high body temperature, and then nurse observing temperature reading within the normal range, which is 36.2 to 37.2. Then we went ahead to state the nursing orders that will assist us to achieve the goal or the objective that we set for ourselves. And then our orders, we say that always make sure you state at least 4 orders. 4 orders. So we have our 4 orders that we believe will help us to achieve our goal. Monitor vital signs is order 1. Order 2, tepid sponge patient. Order 3, serve cold beverages. And order 3, administer prescribed antipyretics. So after these orders were stated, you have to go and perform the procedure. Then after the procedure is performed, you can then come back and then you do what? You intervene. So the interventions are not strictly, it's not automatic that once you state order, you have to state the intervention. So here, because of the academic purposes, I left the interventions here for you to just have a look at. But ideally, you are supposed to go and perform the procedure and come back and state it. So I have performed the procedure and I'm now stating the nursing intervention. Okay. So vital signs monitored and recorded as, so you see, you have to go through well. And then 2, we say temperature was, patient was tepid sponge with lukewarm water. 500 mils of cold malt was served. Then tablet paracetamol 1 gram was also served. So these 4 interventions were made, and we believe that will help us to achieve the goal. Then we go to diagnosis 2. Okay, the second diagnosis is acute pain. That's into bracket low abdominal pain, right? Related to inflamed small intestines. And then our objective is that patient will experience relief of pain within 2 hours of hospitalization as evidenced by patient verbalizing relief of pain, and then the nurse observing patient showing cheerful facial expression. All right, so the orders we gave as follow: assess patient level of pain, monitor vital signs, encourage patient to assume a position that make him or her feel comfortable, either semi-fowless or knee chest. Then you administer prescribed analgesic. So those are the orders we gave, and we have the corresponding interventions. Okay, patient's level of pain assessed using the pain rating scale, and then it was 6 on 10. And then we say patient vital signs was checked and it was recorded in practical terms for you to see. Patients actually assumed knee chest position, and then a tablet paracetamol 1 gram was equally served. Then we look at the third the third diagnosis, which states that risks for imbalanced nutrition, less than body requirement, related to poor oral hygiene, because this patient problem was that patient has loss of what? Appetite. So our objective was patient will maintain his normal his normal appetite within 72 hours of hospitalization. Then there are outcome criteria as evidenced by patient verbalizing increased appetite, and then the next observing patient consume at least two-thirds of or more of the food was served, or the favorite meal served. Then the others that we believe will help us achieve the goal was that you assess patient's mouth or the oral cavity, then you perform mouth care, you serve patient's favorite meal, and then you administer prescribed uh, um, prescribed nutritional health supplements, right? Good. Then after the procedure was performed on the patient, we now come to state it clearly. The patient oral cavity was assessed. That's the gum, the teeth, the tongue, and the mucosa. They were all what? Assessed. We are assessing them for sores. We are looking for plaque, for dryness, and maybe for what? Infection. All right. Then the patient mouth was also cared for with Pepsodent paste and hot toothbrush, and then a rinse with antiseptic hot lotion. Then 10 mils of multivitamin syrup was also served after meal. All right. And then we have our fourth diagnosis. I said that if you really want to understand this care plan, this middle part, it's a continuation from the first one, part one. So go back to my page and listen to and view the part one, the front page. Then you can relate. So anxiety related to unknown outcome of disease condition, and then we set up an objective of patient will experience relief of anxiety within 24 hours, as evidenced by patient verbalizing released that's a relief of what? Anxiety. Okay, that's a reduction in anxiety, or verbalizing reduce anxiety. Yeah, you could say that. The second criterion is that next observing stable vital signs. Yeah, it's moving so quickly. I think so. That's it. So you go to take your time and go through well. What I need you to do is that, having gone through the evaluation, I have not said, you see I left a question mark there. So take your time to evaluate in the comment section, and let's see how you've followed and how you've understood it, and that will help all of us. So the risk factor, we're saying, look at the orders that we gave over there. The orders. So that's it.